Hi, I'm Jessie. I'm an occupational therapist at Alton Physical Therapy. OT is a very crucial part in stroke recovery. Depending on where the stroke was in your brain, it can cause different deficits. You may now have balance deficits. You may have motor planning, fine motor coordination, sensation, cognitive. So many different areas can be affected following a stroke. And what's great about OT is we meet you where you're at. So if you need more cognitive therapy rather than physical therapy, we work on cognitive therapy. If it's more physical and your cognition's great, we work on physical. We want to get you back, and we take a holistic approach in that treatment, looking at the mental, the emotional, and the physical health, and yourself and what your goals are. Common challenges following a stroke are just taking care of yourself. It could just be, now I have difficulty getting out of bed and I've never had that problem before. Or now I can't get dressed and I've been getting dressed for 50 years by myself. What's going on? It's usually those daily tasks that mean taking care of yourself or other people. If you were the primary caregiver, is now challenging for you. And then what OT does is we like to dive in and further evaluate, further ask questions and see what specific areas need to be addressed in therapy in order for you to go back to your daily tasks. Whether that's, again, getting dressed, cooking, things like that. I try to see if there's similarities to the problems. Like if you're now having difficulty with buttoning and opening a water bottle, is it coordination? Is it strength? Is it range of motion? What's the problem? What do I need to address in order for that to carry over into other daily tasks? A lot of times patients come in and the hardest thing to grasp is why they no longer can move a body part. They'll look at me and be like, I am telling my arm to move, why is it not moving? And what I'm trying to do with repetitive exercises and treatment is to build that neuroplasticity, which is the brain's ability to rewire and learn those pathways and to rebuild those actions and that communication between your brain and your muscle. In order for that message, when you're like, hey, reach for the water bottle, when you go and reach for the water bottle, it's now, you're not telling your arm to move, you're doing it instinctually. You're no longer having to tell yourself, arm, lift up and grab the water. It's, oh, I'll reach and grab the water without even thinking of it. In order to do that, we do a lot of that repetitive behavior. We do a lot of that constraint-induced movement therapy. We do mirror therapy. We do robotic therapy, so putting you in like a gravity-limited situation, putting you in that Sabo mobile arm support, using electrical stimulation to help stimulate that muscle, to wake it up and get those neural pathways working again and connecting. A lot of it is repetition with therapy, and because that's how we can judge if things are getting better. We focus on your movement, we focus on the task itself, and if that's improving, it can get very boring. We may be doing repetitive grasping and releasing of a water bottle to work on that opening and closing of the hand. And you're like, I'm sick of this. Well, let's do balance. Let's get up and change the atmosphere and our surroundings around to get you more engaged again. Let's talk, let's plan your weekend. What are you doing? Let's build that relationship so it's not coming to therapy to just do your exercises. It's, I'm seeing a friend or I'm seeing someone who I trust to help get me better and I'm excited. I want that feeling. I want you to want to come to therapy. I don't want you to come and think, oh God, therapy again. Because if that's the case, you're not going to give me that effort that I need from you in order to achieve your goals. You guys need breaks, take breaks. If that means we need to actually build a relationship to make us have a better time together and actually work towards those goals you want to do, then let's do that. I'm Jessie, and this is Alton Physical Therapy.